Hi, welcome to my channel again. It's Dr. Erica. This is licensed registered practicing pharmacist here in the States. Please share and subscribe if you haven't already. I'm Dr. Erica, pharmacist again. Please see my main channel, which is Erica OnagbolaPharmD in the description box. Thank you for joining me. I've been talking in the last few videos here recently about cancer screening, cancer prevention, at home cancer screening as well, what you can do as a individual to be accountable for your status about, again, cancer growth, tumor growth. In the United States, I recently read in Continuing Education Pharmacist Letter Reference that over 600, greater than over 600,000 deaths in the US were due to cancer. Over 2 million cases in 2025 have been detected. Again, over 2 million cases in the United States, 2025, have been detected. That is a that is a large number. That is a great number. Um, In the UK, I think I just heard that it was like 9 million preventable cases that have were detected this year. Again, over 9 million in the UK. So my first thoughts are maybe, people are feeling more or feeling more introverted when it comes to talking about their health. They're more introverted when it comes to talking about preventative measures, seeing a doctor, seeing um, someone who can actually, step in to to help acknowledge and to communicate about cancer side effects, of cancer risk, family history, so forth. Also, I was thinking maybe, people are feeling less confident about their health. They're feeling reluctant about disclosing family history. They're feeling reluctant about their domestic status. I believe plays a large impact on a patient's health. Again, um, also it could be several things. It could be economic status that prevents someone from wanting to know their cancer risk or their screening status. Of course, in my previous video I did talk about you know screening timeline at which to start screening measures, going into the doctor's office to say, okay, I've reached a certain age. It's time for me to be screened for prostate cancer or breast cancer, what have you. I qualify for screening now. I want to know my status. I want to know where I am. I want to know what I can do to further be educated. I want to know, what's my likeness of coming out of this, or what do I have to look forward to or not to look forward to. It's I mean, I'm surprised, but I'm not surprised. Here recently in the UK, um the king uh came out and said that he was recently diagnosed with cancer, um and that in the UK, there's a large amount of people who are not being screened. There's a large amount of people who are not taking their health in consideration. And there's help out there if you would just, trust in, trust in your healthcare provider that they're going to do the job that they were trained to do. I, as a pharmacist, have not had in my 12 years of official practice had someone to come up to say I have cancer or I am interested in learning about a recent cancer diagnosis. I have never had that before. Maybe it's because of the pharmacy setting, the community setting. Maybe it's because um, I don't know. It could just be confidence. Um, it could be um, that some patients just want to talk to. They just want to keep confiding in one medical professional rather than a team of medical professionals. As pharmacists, we work as a team. We work with practicing groups. We work with um, we assist, as far as medication regimen. We do all of that. But again, I think it could be that most patients just choose to not communicate in the community pharmacy setting, and rather communicate, one on one with whomever they choose as their medical doctor or specialist at that time. I I I do want to say that that there are ways that medications are utilized and are implemented um, into cancer treatments, and they work by different mechanisms. There's mainly, I think, four to five mechanisms by which medications work to eradicate cancer cells. Um, there's not always a certainty with it, that there's going to be a true success rate. There's not always the fact that there's going to be recovery, a full recovery. There's patients, that have been lost in the process. There's patients who um, have gone through the process and have been successful. To each its own. However, again, there are many, many preventative measures out there. Um, Even vaccinations. There's vaccinations against cervical cancer. There's vaccinations against signs and symptoms, bacterial infections that could lead to progression of lung cancer. There's there's a lot of different ways that you could at home take care of yourself, eating less sugar items, less carbohydrates. Um, there's even ways that you can detect skin cancer by monitoring your skin, by using antibacterial soaps, by using um, less harsh chemicals, using all natural products on your skin. For example, turmeric, as for example, baking soda, for example, um, moisturizers like pure honey, um, again, turmeric. There's other all natural products that you can use that will help prevent the risk of developing cancer. Also, be mindful that the signs, most of the signs I've mentioned earlier, and I'll mention again, could be or could include um, signs and symptoms: bulging, inflammation. It could be bleeding, excessive bleeding, consistent bleeding um, from one particular area or a certain area of the body. It could even include nausea, vomiting. weight gain or weight loss, mainly weight loss. There could be feeling fatigued or feeling tired at times. You know, all of that is um, a sign or symptom of cancer growth. There are four stages of cancer. Stage one is the detected stage. It's maybe, a small area or um, a benign amount of cancer cells. Stage two is again a greater stage, a more serious stage than stage one, where cancer cells are cancer cells are growing at exponential rate. There may be um, there may be blood vessel growth around or throughout these benign cells that are feeding these cells, allowing them to grow and to become stronger. And then stage three is even more serious, where we may see um, a transfer of cancer cells from one organ system to the next proximate organ system, where the cancer cells have moved along a certain path where they may be growing more blood vessels, and the tumor or the cancer may cause external signs, external symptoms. Stage four is the most serious stage, and with that stage, um, there's there's a less and less of a chance of recovery from a prognosis of end of life. There may be organ failure completely with stage four due to the amount of growth of the cancer cells. There may be a loss of function of the healthy cells. There could also be even more signs and symptoms that are presenting themselves, such as um, a need for chemotherapy, a need for eradication, radiation, a need for extensive surgeries in order to prevent death. So, those are the four stages of cancer. And again, in stage four, oral medications may be permitted. However, at this fourth stage, mainly it's going to be surgery or it's going to be hospitalization um, or hospice care at this point. Again, stage one, stage two, there's a high likelihood that there can be a full recovery with oral medication, with with a team of specialists to help with um, that eradication and getting more stability with normal cells to take over what was lost due to the cancer cells and so forth. So I want to just encourage um, everyone out there to just do your homework, talk to you, be in strict communication with your MD, your nurse staff. That way, you will always know your status. You always know your diagnosis. There are also over-the-counter diagnostic tests, diagnostic kits for colorectal cancer detection. Um, for that particular cancer detection. Um, but mainly you'll have to either have signs and symptoms. Some cancers don't have signs or symptoms. For example, I heard, for example, Deion Sanders had no signs or symptoms of bladder cancer. However, he went in for a checkup on blood clots, peripheral blood clots, and just so happened they noticed a slight offness in his laboratory blood exam or something very minute they found, and they said, okay, let's do a bladder check. Let's go in and do a bladder check. And there it was. They found embedded of the in the lining of the bladder, they found cancer cells. Had they not done the blood work that was meant for blood clots in the periphery, they would have not had they would not have had the opportunity to gain hold of the bladder cancer cells. Now, there not to say that there aren't any signs or symptoms of bladder cancer. Some of those signs and symptoms may be bleeding in the urine, could be also be abdominal pain, could also be a steady dark urine, a redness in the urine, even when drinking plenty of water, which we know clears the urine stream, makes it lighter in color, more yellowish than dark. There still may be a constant flow of dark urine. That's when you want to look further into the cause of that. I I I'm very fortunate myself to learn about this, to know, what it entails, um, to have been a volunteer at different times in my career, uh, been able to work around people who study oncology, people who study cancer. You know, I can't reiterate, the importance of being screened properly. Um, Being screened for cervical cancer, ladies. Every year, pap smear exams should occur. Cervical cancer screening should occur, especially if you're sexually active. Um, Pelvic exam should occur every year as well to detect fibroids, to detect um, endometriosis, possibly for women. Prostate exam should occur for men over age, I want to say 40 for prostate exam, and then thyroid exam. Again, you should see a specialist if you develop a large tumor on the front uh, on the front side of the neck area, and then also developing lymph node enlargement under the armpit, um, lumps under the breast, on the sides of the breast, experiencing discoloration of the skin, um, developing enlarged skin tags or enlarged moles. They may be benign, but they also could be cancerous as well. And then I just want to reiterate that Bob Marley was one who passed away from um, skin cancer, um, and I just want to reiterate the fact that if you've had family members who have developed skin cancer in the past, that that may increase your risk of developing that particular cancer as well. So it's just good to be to be checked out and to know your status at all times. So those are my suggestions. And pancreatic cancer increases with the use of estrogen products. It increases with use of fatty foods. Gallbladder cancer is another one. Abdominal pain is a sign and symptom of that. Change in coloration in the bowels is a indication of that as well. Um, Developing polyps in the rectum, you may see a change in color of the bowel system, dark dark red, orange colored, sometimes dark green colored bowel system or bowel movements is an indication that there may be a chance of cancer growth. So just be mindful of those things, and also, keep communicating with your doctors, keep communicating about what you may be experiencing. Don't let up on any details. Just you know be in the full know of your status at all times. um what else did I want to talk about in this video? If you have questions, comments, please always feel free to chime in and let me know. I'd be happy to give more information about that. Um, we're up on the holiday season now, and that includes being, again, going back to having great attitude, an attitude of gratitude, being thankful, being just being all aware of the time of the season, what's going on around us, helping, volunteering and putting our best foot forward and acknowledging, those who might be in hospice care, who may be on the sick and shut in, those who may be going through, health challenges at this sensitive time of the year. Some don't have access, to their families, friends. So just reach out, just it could be a greeting card, it could be a letter, a handwritten letter to someone. It could be a gentle hello, or a hi, congratulations. It could be something very simple, this year. It doesn't have to be an expensive gift. It doesn't have to be all out, but do be mindful of of the season and the reason for the season and what it entails, and so forth. I'm in solitude, most of the time. I'm trying to get my YouTube channel off the ground and get more into the rhythm of what it means to be a committed pharmacist, to be a committed healthcare provider, to be, an asset to the team of healthcare, and to myself, to be more real with myself about what I want, what I pray for, and being a go-getter. Sometimes it takes um, a little bit extra, push to get started or to maintain. But there is, if you're a believer, there are, ways to maintain positively and to be successful and so forth. So I just want to let you all, be encouraged right now. And we just came out of Thanksgiving, so we have a lot coming up. Less than 2 weeks for Christmas now. So Yeah, and then New Year's is coming, so that's positive as well. Um, New opportunity, a new set uh, of promises and purposes to fulfill each day that we're giving the opportunity to, um, to be alive on this earth. So, yeah. So again, if you have questions, comments, concerns, please feel free um, to reach out. Also, stay tuned on the latest national news, the latest international news, and be mindful about friends and family during this time. Not everyone is fortunate to receive and to be a part of um, the festivities. So yeah, and I hope to see you on my next video. This is Dr. Erica signing off. Take care. Adios. Bye bye.